BioCheetah's. So I'm Ervinna Pang, the Chief Business Officer of BioCheetah. So today, I'm going to introduce you our company and our product. So we are actually a medical diagnostic startup company that developed the best-in-class, non-invasive bladder cancer diagnostic test. So we envision to be the leader in urine analysis for urological cancers. Urological cancers consist of bladder, prostate, and kidney cancers. Our flagship product in bladder, our pipeline in prostate and kidney, both in the form of diagnostic lab usage as well as home care for personal use. So bladder cancer, let me take you through our flagship product. In the US, it is actually the fourth most common cancer among males and sixth most common cancer in both genders. The new cases is projected to increase by 50% until 2040. Unfortunately, it has a very high recurrence rate, 70%, and that leads to lifelong diagnostic surveillance, which resulting in the highest lifetime treatment and monetary costs among all cancers. It has a very common symptoms: blood in the urine, frequent urination, back pain, painful urination. So anyone that actually exhibits these symptoms, unfortunately, will be prescribed with a very invasive standard of care diagnosis, cystoscopy. As can be seen here, very invasive because it has to go through the urethra in order to reach bladder. So it is invasive with a very long waiting time, and even it is a standard of diagnosis. In the US, it does not receive full reimbursement. There will be $300 out-of-pocket expenses, unfortunately. So because of the lifelong recurrence diagnostics, how frequent it is, the lifelong diagnostics. For the first 2 years, every 3 months, the patient after treatment of bladder cancer will need to go through this cystoscopy 8 times for 2 years, followed by twice to once a year, every year, lifelong. So at BioCheetah, we have developed our flagship product, VKNDX ELISA system, that consists of the VKNDX ELISA kit as well as the analytics to generate a risk score for the test report. Our key differentiators: totally non-invasive, a small amount of or volume of urine. We have a portfolio of IP family that building across this ELISA kit, proprietary biomarkers, proprietary antibodies with patents that have been granted in many countries, including in the US. Our analytics is our trade secret. And it's very easy to deploy because it's ELISA-based, no cost of conversion by any clinical diagnostic labs, no manpower training, no CapEx. And it leads to a very competitive pricing of our flagship product. We have conducted a global clinical validation studies across all the major hospitals worldwide, 1,500 subjects that give us a partial data of best-in-class performance. How good it is: 100% sensitivity, no false positive, and 94.6% specificity, 100% NPV, 95.3% accuracy. This year, today, we are launching our US clinical utility study with the major hospitals here that you can see to support our medical reimbursement. What is our performance and other key differentiators compared to our competitors? So unfortunately, majority of the key competitors suffer from their performance. So for example, as you can see here, the very low sensitivity that will be really missing out the true positive. And not only that, some of them are actually priced in a very high pricing. A more recent diagnostic test that can be found here in the US, they unfortunately suffer from a very high turnaround time and very costly that recently the reimbursement has been taken out. So we actually will be available as LDT in the US by early next year, followed by the IVD. That is our go-to-market strategy with very favorable pricing, low or short turnaround time, and also very low barrier to deploy with the best-in-class performance of VKNDX. Our US key opinion leaders, urologists, are very favorable in deploying our test, and they are very confident that when we apply for the reimbursement, it will be approved. So we already have commercial partners outside of US. In the US, the next 6 months, we will be finalizing our commercial partners and will be launching our LDT test with our diagnostic lab partner. So we are raising our Series A of $3 million US dollars simply because we have started generating income from 2023. So out of this $3 million, $2 million has been committed, and from there we hope that it can be finalized, our commercial partner in the US, CPT code application, as well as the clinical utility studies in the US. By early next year at most, we will be launching as LDT, followed by the IVD application. Concurrently, the test will continue to generate sales in the other part of the world. We consist of a team of veteran industry, as well as industry veterans, as well as translational scientists with combined experience of more than 120 years. So we are based in Singapore. Feel free to reach out or contact us. Thank you.